gaslighting your own fetus and politicizing with misinformation is not something I had on my bingo card. I'm going to try to keep this one as delicate as possible, but this is where accountability is a motherfucker. Watch this video and we're going to discuss it.
Is unviable. In my case, I was 5 weeks pregnant. There was no heartbeat, and no ectopic pregnancy is viable. And that's so important because the mother needs care immediately. But unfortunately, women's healthcare has been subject to the worst fear mongering that you can experience. And so they had actually been receiving, these healthcare providers had been receiving pro-abortion lobby ads to the tune of millions of dollars being spent on these ads that were threatening and scaring doctors away from helping women, saying that they could lose their license, they could go to jail. In fact, in the room, I had nurses and doctors showing me these advertisements saying that they felt uncomfortable because they didn't want to go to jail. They wanted to help me, but they felt like they couldn't do anything. So I literally was laying on the table reading them the law. And it dawned on me as I was sitting there with my husband, this is what women are experiencing because of the fear mongering around women's healthcare. And it has to stop. The left absolutely played a role in making sure that doctors and women were scared to seek out the help that they needed. And so I think that this is a wake-up call. My story should really bring forward the national conversation that's long overdue about the lack of maternal health care. And really, I think it's important that we highlight that doctors aren't to blame, women aren't to blame. We need to get the politics out of women's healthcare.
Congressman,
The way I had to watch and listen to her say this was fucking insane. Ma'am, I'm going to break some things down for you and you're not going to like it, but take a seat, babe, because you're going to learn today. See, you have a strong abortion stance about no, unless maybe. And because of people like you and people you support, you were the reason you were in that. And again, you saying and talking about this while you are currently pregnant, girl, that is some of the worst karma you could fucking do. You already have issues that are high risk in your own pregnancy, and I'm going to show them to you right now in case you are unaware. See, because Kat, you're 37 years old. You are what's called advanced maternal age, or AMA. Here are just some of the risks with AMA. Increased risk of miscarriage, genetic abnormalities, gestational diabetes and preeclampsia, placental abruption, and preterm birth. Those are just the AMA ones because you are of elderly age to have a baby. And while there is no shame in any weight anybody has, because baby, I'm fat too, but girl, you are obese, if not considered morbidly obese, based on a BMI. You are somewhere, guesstimates give, between 180 or 220 pounds in this picture, which was right after your ectopic pregnancy was ended due to methotrexate. And the obesity-related complications, again, gestational diabetes, preeclampsia, macrosomia, cesarean delivery, and others. Things like blood clots, infections, anesthesia-related complications during delivery. And here are some of the complications associated with AMA and obesity prior to becoming pregnant on the baby. Birth defects, fetal growth restriction, fetal macrosomia, preterm birth, prenatal mortality, perinatal asphyxia, childhood obesity, childhood asthma, neurodevelopmental issues, and others like type 2 diabetes and heart conditions. So you mean to tell me you were out here in the fucking wild saying this was a leftist issue because doctors were afraid? No, babe. Even though you did not vote specifically to help end or restrict Roe v. Wade, you are on the fucking board. You are a co-chair of the House Pro-Life Caucus. And while you have some, maybe I support some abortions, you don't support them all, which makes you a fucking hypocrite. And let's not make the mistake of understanding why you were given abortion care. It was ectopic, it never would have survived, and you needed intervention. But the doctors were scared, but still gave you methotrexate. You can claim it didn't have a heartbeat, but maybe it did at one point. But you were given care because even during that moment, you pulled up your phone to show doctors the law. That is called white women privilege. Florida had a 6-week abortion ban, but you were a white woman of privilege. Privilege. See, because this right here from the CDC's own site, pregnancy-related mortality ratios are 3.2 times higher for black women and 2.3 times higher for American Indian, Alaskan, Native than for white women. Black women are never believed when there's an issue and people don't give a shit. And when white women of privilege cry like Karens, all of a sudden they get whatever they want, no matter their stance, because rules for thee and not for me. And again, while you did not specifically vote for it, you have advocated for it. And since the overturn of Roe v. Wade, 210 women in the United States have faced criminal charges related to their pregnancies, including those involving pregnancy loss. 210 women. You should be charged, right? I mean, you had an abortifacient, even though it was ectopic, that baby still had a chance, right? Just because you're a fucking representative doesn't mean you get to cherry pick who gets to decide when and why abortions should happen. Abortion bans have delayed emergency medical care. In Georgia, experts say this mother's death was preventable. She couldn't get care, it was preventable. But you sure the fuck got your care that you needed, right, Kat? So let's summarize this up. I hope your baby is born healthy, happy, and beautiful. But because of your weight, because of your age, there are increased risks. Period. It's a fact. I know because I was a high risk, advanced maternal age mother for the first time. These are facts. It has nothing to do with body shaming, so you can throw that right out the fucking window. You had to show doctors your phone to discuss the law for them to give you methotrexate, which is an abortifacient, which you would deny others. Ectopic pregnancies usually occur between 5 to 10 weeks, but can appear as early as 4, as late as up to 12. And guess what? That baby could have had a heartbeat. So respectfully, ma'am, shut your fucking mouth. Respectfully, ma'am, maybe don't talk shit about the fucking left when it is you and your ilk and your kind and conservatives the reason that doctors are scared because Roe v. Wade was taken away. This is a fucking 100% your fault. When your child is born, maybe you don't gaslight. Maybe you don't give misinformation. Maybe you don't rage bait. Again, you're pregnant, and the fact that you're even doing that pregnant is so fucking gross.